Hello, Andrew Collishaw here. I hope you're well, and I just want to take a couple of minutes to explain some important things to you about taking naturopathic medicines and homeopathic medicines. Sometimes when we're treating a particular problem, or you've come in with a particular problem, a skin rash or tonsillitis or some awful cold or flu or pains, migraines, whatever, in order to treat this, what we sometimes do is we need to look at other things that are going on with your health and treat those other things in order to improve the problem that you came in for. So just keep that in mind, because the medicine or the medicines that you're taking may not be specifically directed at, for example, your skin, and that's okay, because in naturopathy we look at these other factors which will be influencing your skin. So does that make sense? That probably would have been explained to you in the consultation, but just remember that. Also, it's really important that as we begin to improve your health, if there are suggestions that we make, say for example suggestions about your diet, or if you have trouble taking tablets or trouble attending appointments, anything like this, you need to let the practitioner know, because there's no point in the practitioner suggesting all these wonderful things if you're not going to be able to do them. So let the practitioner know, and we will work around what you're able to do and what you want to do. We'll take you as far as we can, but within the boundaries and limits of what's comfortable for you. Okay, so we're not going to get everyone doing, really strict diets that are impossible to follow. That doesn't work, does it? So let us know if something is too hard, or if you can't do it, tell us, okay? The other important thing is to write down any changes that you notice while you're taking medicine, any improvement of symptoms, or if you get a bit worse, or if something is different. So if you wake up one morning, for example, and you feel that you've had more energy than you've had for ages, make a note of that, because if that's just for one day, then when we see you at the centre, a month later, you might forget about that one morning that you felt absolutely terrific. Now that's really important. That can be very, very significant in terms of the sorts of medicines that we use. So make a note of all the little changes in your diary so you don't forget to tell us anything. The other important thing is, if you think the medicine isn't helping you, or it could be making you worse, then you need to let the practitioner know, because it's just a waste, isn't it? If you're taking medicine for weeks and weeks and you think nothing's happening, and you're thinking, well, this isn't doing anything, just if you're concerned, then call the practitioner, okay, and we'll explain what's going on and work out if we need to change your medicine or change the dosage or the potency, something like that. So if you understand what's going on, and it's been explained to you that yes, well, this will take 6 months of treatment, very slow process, then you know that's normal and that's fine. But if you're concerned, just give the centre a call. Also, the last thing I want to mention is that medicines work at different speeds for different people. It depends on what we're treating, and it depends on the state of your health. It depends on a whole lot of different factors. Now, there are clients who will get relief or improvement very, very quickly, within hours or within an hour sometimes, depending on what it is. There are other clients where it will take 6 months of very careful monitoring and treatment before we start to see improvements. So this is something that will be talked about with the practitioner, so you just need to keep that in mind. And if it's a longer running process, then you will need to be patient. Naturopathy isn't a magic bullet, but it can certainly do wonderful, wonderful things, and I've seen it do wonderful things for people and improve their health so much. But sometimes you do need to be patient, but we'll help you optimize the healing, and we'll help you with any queries that you have about that. So I hope that's helpful, and as I always say, look after your health, and we'll talk soon. Bye for now.